Hello, everyone. My name's 𝗥𝗘𝗦𝗃𝗧 and I'm one of the co-CEOs and co-founders of the DLD project. And it is my great pleasure to announce the winners of the 2024 DLD Research Grant. And two of our team are with us today, Tamara and Rouzana. Welcome.
Thank you.
Thank you for having us.
We're so excited to be able to announce the DLD Research Grant. In fact, it's one of my absolute highlights of the year. We had so many fantastic applications this year, and we really had to work very, very hard to decide on who the successful grant winners were. But before we talk about the project, I do want to acknowledge that the funds from the DLD Research Grant were raised from our 2023 conference. So I really want to thank our IDLDRC participants who came along last year to enable this grant opportunity to occur. Tamara, I might hand over to you first, if that's all right. Would you mind talking to everybody a little bit about the research project and perhaps describe what you guys have got planned?
Yeah, absolutely. The project is about creating a model in the form of a roadmap to identify, assess, and support children with DLD in low and middle-income countries like Georgia. So the study will be conducted in Georgia, and we want to address the problem that countries like Georgia have, where there is no or less developed system to identify and support these children. So in Georgia, it's healthcare professionals like pediatricians, child psychiatrists, and neurologists who can formally diagnose children with DLD. But the problem, and then they can refer them to speech and language therapists for further support. But the problem is that the awareness and knowledge of DLD among professionals is very low, and they've been expressing needs to gain more knowledge of DLD. So our project will have two main aims, and the first one is to identify barriers and facilitators to the identification and support of children with DLD within the healthcare system. And the second aim is to document how speech and language therapists work to support these children when there is no infrastructure, where they lack assessment tools and have many other challenges. So the project will be guided by the principles of implementation science. So Rouzana's competence is really key in this project. And implementation science will help us understand what hinders the service delivery and how to improve practices to better support children with DLD. And to address the first aim, we will organize focus groups and individual interviews with healthcare professionals to understand their perceptions of barriers and facilitators to the identification and intervention. And based on the findings from this sub-study, we will create a detailed thematic map that will highlight the key barriers and facilitators which healthcare professionals meet in their daily work. And to address the aim two, we will conduct individual interviews with SLTs from both public and private sectors to understand their day-to-day practices, how they work, how they support these children, how they, what happens after these children have been referred to them, and how they collaborate with parents, with other professionals, So, and also language profiles of Georgian-speaking children with DLD, because we don't actually have this data available, but we guess that SLTs have, we know that they have this data, so we will ask them about this. Based on the findings from these two sub-studies, we'll create a roadmap that will be created in Georgian, but then we'll translate it into English. And the roadmap will serve as a strategic guide for shaping and advancing research and practice related to DLD in Georgia and in other countries with similar socio-political context and needs. So, and the roadmap, so we'll be also applying open science or open research practices, and we'll try to make all the materials and the products available to as many people as possible, which of course that can be legally shared, so as many people as possible can benefit from them.
We're really pleased because that focus of internationalization, also, I guess for me, moving away from an English language focused view of DLD is just so critical at the moment. There's so much information out there, but it really sits in the English language, and our understanding really focuses on Western health systems and the way that the US or Australia or the UK might engage in identifying and supporting children with DLD. So this roadmap, I think, is a really exciting move forward, and it has such huge implications for people in Georgia with DLD, but also providing that framework for other countries to look at identification and support as well through their own cultural lens and context. So fantastic. Rouzana, I might ask you to expand a little bit and perhaps talk to how do you think this project will help people with DLD, perhaps in the short or long term?
Yeah, so we see potential impact in different areas. Of course, starting to set a foundation for authentic and meaningful community engagement with healthcare professionals, speech language therapists, and families of children with DLD, and educating about DLD, because there's definitely low awareness, as Tamara mentioned, and we are planning to address that issue as well. We want to understand current services and identify what works, what doesn't, and use that information to improve service delivery, but also to inform development of research in Georgia, research that is aligned with practice needs. And beyond Georgia, we want to inspire efforts in other countries with the roadmap that we aim to create, because this question of where do you start when there's limited infrastructure and resources is very critical. And we need to conduct studies to find the answers. And so we hope to inspire researchers and practitioners in countries with similar needs towards the improvement of services for people with DLD. And we are also particularly excited to see the application of implementation science in this project and expand its use in DLD research and practice, and hopefully arrive at a point where we can say that we've started bridging the gap between research and practice, and we know that this gap affects access to timely, quality, and equitable services for people with DLD. So hopefully with the work that we will produce and the knowledge that we will produce, we can inform both DLD research and practice and support people with DLD and their families.
I think it's such a practical and important outcome for any research, is really bridging that gap and making sure that the research directly supports the people that it's intended to help. So I love that you've talked about implementation science. We know that it's an area of passion for Rouzana, but for you as well, Tamara, and that you'll be able to utilize that lens for looking at this particular project. So thank you both so much for joining me today as we announce you and your wonderful team as the successful recipients of the 2024 DLD Research Grant. Before I close, I do want to thank our sponsors for last year's conference, in particular our platinum sponsor, Fremantle Speech Pathology Services, as well as Language Dynamics Group, Black Sheep Press, and Messinian Research and Consultancy. Without our wonderful sponsors, we wouldn't be able to have the International DLD Research Conference to be able to fund DLD research grants each year. So thank you to our sponsors and our participants at last year's conference. And we're really looking forward to sharing the findings of your research very soon. Thank you both so much for your time.
Thank you for having us.